Hello, this is Gary Pace, the Lake County Public Health Officer, and this is the COVID update for Friday, November 20th. We now have had a total of 823 cases and 18 people have died so far. The situation around the state and around the country is very worrisome, with case rates rising rapidly. So far, Lake County remains in the red tier, but many areas are putting more restrictions into place. Our numbers have increased, and we may be looking at going into the purple tier in the very near future. The governor announced yesterday that there's an advisory for modified shelter-in-place order to take effect starting tomorrow night at 10 p.m. for up to a month. Non-essential work and gatherings must stop from 10 p.m. until 5 a.m. for counties that are in the purple tier. At this point, there are 41 counties out of the 58 around the state that are in the purple tier, including most of our neighbors. Since we aren't there yet, this order doesn't apply to us at this point. So I want to congratulate us on the good job that Lake County has done since the fall in protecting our families, neighbors, and coworkers. We've had on average 37 known COVID-19 infections every week since mid-September. This has kept us in the red tier, indicating substantial transmission instead of the widespread transmission that you see in the purple tier, and that's happening in almost every county in the state at this point. We know how to protect ourselves and to watch out for our neighbors. Masks or face coverings, physical distancing, and making our workplaces safer all have been pretty successful. Now is a critical moment. With everyone moving indoors due to colder weather, the risk goes up. Any actions that we take now will place us on a better trajectory for the winter. Our information shows that 2/3 of all the people infected in Lake County have gotten it from household or community transmission, like social gatherings. Please think about how to be safe this Thanksgiving and having the kinds of tough conversations with family and neighbors about doing the holidays differently this year to ensure that we keep our loved ones and families safe from getting sick or from spreading the virus. Over 50 Lake County residents have been hospitalized due to COVID since the pandemic began. The median age of these hospitalized cases is 63 years. And very sadly, there have been 18 deaths. The average age of these people who died was 74 years. Most of the people who died, including this most recent person, were residents of nursing homes at the time of their infection. Many people are not sick when they test positive, and many others have pretty mild symptoms. But this virus can cause severe illness and long-term problems for anyone, even young, healthy people. To give a sense of what we are seeing in the hospitals, here's a story from a friend of mine who is an ER doctor in Northern California. I had a particularly poignant event 2 shifts ago. We were short an ICU doc, and I was called to the ICU to stand by to put the breathing tube into a COVID patient in case it got pulled out in the process of proning, which is when you turn somebody from their stomach to their back as one of the ways to help them breathe. If people only knew what our ICU nurses do on a daily basis. As I arrived and donned my full body PPE, which looks almost like a moon suit, and with all the required masking, I witnessed a team of 9 staff, all in their protective gear and masks, gather in this tiny ICU room. It's an old hospital. There were wires and tubes snaking all around, hardly any room to move. Some of the staff were young. Many had gray hair. It took 10 minutes after all were assembled to roll our unfortunate patient from their stomach to their back. I was so relieved that the ET tube was not dislodged, but I was also incredibly impressed with the teamwork, dedication, and professionalism that all the staff showed in handling this patient like he was one of their loved ones. And the way things are going, it will happen again on the next shift and the next and the following. Same event, different players. If those who are not wearing masks could witness what I did, they might think differently, especially as we run out of ICU beds. And in the county I am in, there were 0 beds last night and only 2 beds available today. So that's the end of the story. There's also a link that we're going to include that shows an ICU nurse in Nebraska who's talking about her experience, just so that you can get a feel for what's going on in the hospitals that are getting really heavily impacted. That's not what's happening in Lake County at this point, but we're seeing this in a lot of places in the area and around the country. So our actions within the next few weeks will shape the holiday season. We urge you to find alternatives to gathering with people outside of your household, and if you do get together, wear a mask and keep distance. The state is discouraging travel now, and if you do travel out of the area, they recommend a 14-day self-quarantine. That means you don't go to work or go to school or out in the community at all for 14 days after you return, so that in case you do turn positive, you don't spread it. This holiday season, we recommend not doing the usual holiday activity. Have a quiet, stay-at-home Thanksgiving. It is much safer. Hopefully by next year, we will be getting back to normal. This year, let's do everything we can to avoid widespread transmission, avoid more people getting sick, avoid more hospitalizations, and avoid more premature deaths. Thank you.